My name is Diana Isaacs. I am a clinical pharmacy specialist in endocrinology. I work at the Cleveland Clinic in Cleveland, Ohio, and I have board certifications in pharmacotherapy, ambulatory care, and diabetes. And I've actually been working 16 years as a pharmacist. The last 9 years have been at Cleveland Clinic, where I do medication management within the endocrinology department. That is a great question. And when we think about all of these different endocrinology conditions, there are pituitary disorders as well as adrenal insufficiency. And these, in terms of the medications that we're using to treat these conditions, we have something called glucocorticoids or steroids. Often hydrocortisone is a drug that is used to treat that. And it is vital for the stress response, for blood pressure regulation, immune system function, metabolism of proteins, carbohydrates, and fats. And hydrocortisone specifically is the most prescribed drug in this class. And that is because it really mimics the body's natural way of producing cortisol. So while there are other drugs that can do this, this is really the most natural. There's also something called mineral corticoids. So those are drugs like fludrocortisone. And these are drugs that help with the aldosterone production and are really important for balancing fluids in the body and maintaining healthy blood pressure. And so in people that have secondary adrenal insufficiency and don't produce enough of this is also really, really important. And not getting enough of these medications can lead to something that we call an Addisonian crisis, which can be a life-threatening medical emergency. When it comes to pituitary disorders, we have something called desmopressin, which is very important for a condition that used to be called diabetes insipidus. And this is where, someone doesn't produce, has this vasopressin deficiency and doesn't produce enough of this and really needs this for their fluid balance as well. And then in terms of kind of some other other conditions in the whole endocrinology space. So when it comes to diabetes, insulin is life sustaining, especially for people with type 1 diabetes, but many people with type 2 diabetes also require insulin to be able to manage their blood sugars. And unfortunately, when you don't have access to insulin, that can be a life-threatening emergency, just as if you didn't have access to cortisone and you had Addison's. And this also can lead to other consequences as well, that if you don't have enough insulin over time, that can lead to increased risk of complications, like, for example, affecting a person's eyes, it can cause neuropathy where they're having tingling in their feet. Also, having high blood sugars over time can lead to cardiovascular conditions. So even puts a person at risk of having heart attacks, of having strokes. So medications for all of these conditions are definitely super, super important. And when they are not available, it can cause both acute problems, which can unfortunately, worst case scenario could be the difference between life and death, but long-term can lead to just a lot of discomfort and can lead to long-term consequences in terms of just these microvascular complications as well as the cardiovascular diseases. So unfortunately, the unavailability of medications can really negatively affect someone's quality of life and mental well-being. There can be a lot of stress about how to access the medications that a person needs. And, in worst cases, this can lead to somebody rationing out their medications. And so I'll give you an example. I had a patient that was worried about having enough access to insulin. And in the past, we've had various shortages related to different types of insulin. And sometimes cost also gets thrown in there too. And so this person was actually rationing it and sharing it with a family member. And so not getting the full dose of insulin, but kind of just getting enough to get by. And of course, having the high glucose levels can become problematic. Unfortunately, in this case, it wasn't originally shared with their healthcare provider. And so naturally, if someone seems like they're not meeting their goals, the next step is usually those medications are increased. And so in this case, insulin doses were increased. Well, once the person had access to more medication, she ended up taking the full dose that she was prescribed, thinking, hey, that's what I'm supposed to do. And it ended up being too much and then causing hypoglycemia. So, not getting the right doses of medications and not having access to them can really lead to so many problems. Additionally, people can experience more anxiety, depression, irritability, especially when it comes to drugs used for adrenal and pituitary conditions, where it really can be impacting these different hormones and causing them to just not feel good, to feel very fatigued. And that can further really disrupt daily life along with mental health. And so this really can be a huge, huge burden in addition to the physical effects that you would expect these shortages can occur, that also that just emotional toll and that impact on a person's quality of life. There's multiple causes for medication unavailability and shortages. And some of those are just manufacturing and quality control issues. In fact, these are consistently identified as the most common reasons for drug shortages. And some of these problems include production delays, unexpected facility closures, and significant quality control issues, which then can cause disruptions in the supply chain. And in addition to that, there's also what it happens with the pharmaceutical market and supply and demand. And sometimes what's anticipated, there ends up being more demand. And one example of that is in the case of GLP-1 medications, where we did not expect there would be this explosion in demand. And so for a long time, there were shortages where people could not access those medications. And now that manufacturers have been able to increase the demand, that's mostly resolved, but that takes time to invest in those resources. For more rare conditions, like Addison's or like acromegaly, that can be a little bit more challenging because there's less of a demand for these medications. And so, in terms of the incentives for manufacturers to be creating these medications, there is not as much. And so, sometimes the economic dynamics, sometimes governments will incentivize companies to make sure they are providing enough of a supply, which is really needed to make sure that we have enough. And then, in addition to that, as well, sometimes natural disasters impact the supply. So, for example, in the US, we had Hurricane Helene, which impacted Baxter's facility where they make IV fluids. And so, specifically, normal saline was on shortage for a very long time, which is used for so many things. And so we were having to ration it within health systems, and that sometimes there are more and more natural disasters happening around the world. And so that's something that can immediately disrupt the supply, that we have to kind of pivot and come up with other solutions too. And then with all of this, unfortunately, what happens is when there's low supply and there's more demand, naturally the price is going to go up of things. And one of the concerns is that this really then negatively impacts poorer countries that may not be able to compete with richer countries for paying the price for these medications. or, not having equal access around the world. Some places may have access and then trying to get it to other areas where it's in need, where it's more rural. And so these are, definitely some of the challenges that lead to all of these shortages. Healthcare providers, there's a lot of things that they can do. And one thing I want to make everyone aware of is generally we do get alerted about shortages. There are different organizations, like in the US, we have the American Society of Health System Pharmacists, ASHP, and they do a great job of letting us know what drugs are on shortages, what is currently available, like if there are generic alternatives that are available. Also, our FDA has a list of current drugs on shortages. And so generally we are aware, although sometimes, honestly, sometimes it is the patient that at first brings it to our attention, because I'll be honest, I'm not, on that website 24 hours a day, right? Now, in terms of adapting plans, fortunately, we can get creative, and usually there are ways to work around and use other medications, but it can be very challenging. And one thing I want to actually specifically bring up is the hydrocortisone emergency kit, because this is a kit that is really for anyone with Addison's. Like, this is something that they should have, because at any point, if they have increased stress and they don't have enough hydrocortisone, they're going to need a replacement. And they should always have this emergency kit available just in case they're not able to take in the tablets, they're not able to get enough cortisone. So interestingly, this kit has actually been on shortage. And unfortunately, it's expected to be on shortage through next year. Now, there are alternatives. So that's the good news. I think what is hard about it is the original kit is it's it's ready to use. The other ones require reconstitution, meaning mixing liquid and powder together, which can just take a little bit more time and a little bit more education. So it's something that can be overcome, but it does require that extra time, understanding, and making sure that we are educating people on how to use it. Now, for other medications, like in the case of cortisone, if that's on shortage, we have alternatives. Like we can use hydrocortisone, for example. We even have other steroid types of drugs like prednisone. The challenge is that they don't work quite the same. And there may be some patient impacts in terms of just getting that just right dosing. And so it really requires a skilled healthcare team, a skilled endocrinology team to work with a person to really individualize those doses to try to get a treatment plan that will work as closely as possible and make the person, help them to feel good. In the cases of the insulin shortages, so we have several different types of insulin. Most recently, actually, there was an insulin that was discontinued called Detamir. Levemir was the brand name, and that was a decision by the manufacturer to discontinue it because now there's other insulins and a variety of reasons. Unfortunately, we had a lot of people that were using that type of insulin. And so some people were trying to save it to really get down to that last drop, but ultimately had to switch. And so again, it just requires that working with a healthcare team to get that right dose. Often it is a straight, what we call like a 1-to-1 switch. Like if someone was on 20 units, we switch to 20, but then it often needs to be tailored, going up or down a little bit. In the cases of when fast-acting insulins aren't available, yes, we also can often switch, but sometimes it affects someone a little bit differently. So we need to work with that and make sure they've got treatments for low blood sugars as needed. And then the other area that I think has been a hot topic just in general are the GLP-1 drugs, those glucagon-like peptide drugs like semaglutide and tirzepatide, which those have been on shortage for a while, really due to the increased demand being probably way beyond what anyone had expected. And this has been very challenging because this people have been doing very well, especially people with diabetes, people with overweight and obesity have been doing very well taking those medications. But the problem is when they are stopped, especially when they're stopped abruptly, that can lead to this weight regain pretty quickly. And then also in the case of having diabetes, those blood sugars going up pretty fast. And so often we have to really identify what can we do, adding additional medications to make sure the blood sugars are at goal. And in the case of weight, that's really challenging because losing and gaining and losing and gaining is not good. And so we really want to try to implement strategies so a person doesn't just gain a ton of weight back. And I think this also goes to the importance of lifestyle and working with a whole healthcare team like dietitians and really working on nutrition strategies and physical activity. And ultimately, fortunately, now a lot of these drug shortages in the case of like the GLP-1 drugs now have been resolved, but that was definitely a major, major issue over the last year. There's a lot that can be done to really help to prevent future shortages. I think it's not going to be possible to totally prevent any shortage from ever happening. So I think we should still be prepared, but there are certainly a lot of things that we can do. When it comes to operational improvements, I think working to make sure that there are early warning systems that we are notified and ideally in advance if there's going to be a shortage so that we can take action. Also, knowing if manufacturers, this is where we can actually use cool tools like artificial intelligence, AI, to model and predict how is that supply and demand going to be? Is there a potential for a shortage? And actually alert that, hey, there needs to be increased production. What things need to happen to ensure that there won't be a shortage? When it comes to policy, so policy changes to really incentivize manufacturing, making sure that there are enough of the active pharmaceutical ingredients and really streamlining regulatory approvals, especially for conditions that may be more rare. In the case of a lot of adrenal pituitary conditions that may not be, not as common as diabetes and obesity, but still very important and very critical that people have access to their medications. And then in addition to that, definitely making sure that there is strategic partnerships. So, for example, that we're all talking to each other. Sometimes there may be a shortage in one country and there's not a shortage. There's actually plenty of the medication in other countries. And so really having those open lines of communication, making sure that the drugs are accessible all around. And not kind of just in one place, but that we are able to reach it everywhere. And then I think that also a lot of professional advocacy as well. I think it's important to make sure that our, policy makers are aware of how important these conditions are and how important it is that people have access to their medications. And while that there can be a substitute, often the substitute may not be as good. And so we really need to do what we can to make sure that there is enough of the medication. And I think that's where also advocacy efforts are very, very important, making sure people are aware of the life sustaining medications and how this is not a luxury. This isn't just a nice to have. This is truly life sustaining. And it is very important that people have access. And we don't hear of stories of people trying to ration their medications or worst case scenario, even dying because they didn't have access to their cortisone or to their insulin.